Thank you, Mr. Williams, and a warm good afternoon to everyone. This afternoon, I will proceed in sharing with you the Health Emergency Operating Center's Situation Report for Wednesday, April 28, 2021. To date, the Federation would have reported only 44 confirmed cases. All cases have recovered. So at present, we aren't following any positive persons. It's interesting to note that our last case was identified some 42 days ago, and so that's good. Between last year, January to present, over 147.5 million persons have been impacted by COVID-19, and over 3.1 million persons have died. But concurrently, vaccines, the COVID-19 vaccine candidates have been rolled out globally, and to date, over 961.2 million doses have been administered already. In the United States of America, 32.2 million confirmed cases have been reported, and almost 575,000 deaths have occurred as a result of COVID. The infection, COVID-19, continue to impact the Caribbean region and the CARICOM member states. So the numbers continue to rise. So within CARICOM, amongst CARICOM member states, the islands would have reported over 156,000 cases and almost 2,600 deaths. Now, within the Organization of Eastern Caribbean States, meaning the 9 member states, over 11,800 confirmed cases were reported, and also approximately 161 deaths. But interestingly, I want us to pause and focus on Anguilla at this point in time. So our colleagues in Anguilla would have identified a cluster of cases 1 week ago, that's last week, Wednesday, and between last Wednesday and yesterday, they would have identified 60 positive cases linked to this cluster. So as at yesterday, they would have identified 60 positive cases linked to this cluster. And so the total number of confirmed cases in Anguilla far exceeds 80. It's 80 something now as we speak, and rising. And it's alleged that the genesis of this cluster arose out of undocumented migrants who would have come into Anguilla from St. Martin. And so there's a lesson in that occurrence for us here in St. Kitts and Nevis. And I think as a federation, we need to monitor our borders very closely. And so we are pleading to everybody, to all of society, to come on board in terms of helping us to monitor our borders. So if you are in Keys Village, Challengers, Sandy Point, and you see an unusual vessel pulling ashore, and if you see any strange faces in your community, it's your responsibility to call or reach out to the police and make an alert in this regard. St. Kitts and Nevis, we would have rolled out our COVID-19 vaccination program 9 weeks ago, and based on the figures just coming in this evening, we would have administered 12,432 COVID-19 vaccine doses, 12,432 doses. More specifically, 9,428 doses in Kitts, 3,004 doses in Nevis. And so we would have covered 37.6 or 38% of the target population that we are catering to or focusing on and by extension, we would have covered 26.3% of the total population with at least one dose of the AstraZeneca Oxford vaccine. So that's an update on our COVID-19 vaccination rollout or plan. We continue our surveillance on island. Anyone who presents in the emergency room, Alexandra Hospital, JNF Hospital, with COVID-like symptoms, you are swabbed, your sample is processed. So we continue testing. So to date, we would have tested over 13,000 persons so far, with a mere positivity rate of 0.3%. This just highlights the number of persons in any quarantine or vacation in place facility. We have 8 in home quarantine. They utilize the pre-approved home quarantine facility. To date, we would have released over 8,000 persons from quarantine, and so this figure represents what pertains between last year to present. So this afternoon, again, I'm going to just share additional information or recap general information regarding the AstraZeneca Oxford vaccine that we are offering to our citizens. So again, if you come on board, if you accept this vaccine, once you are fully vaccinated, you will enjoy an 83% risk reduction in picking up COVID. We are administering 2 doses, 8 to 10 weeks apart. And it provides you coverage against the emerging SARS-CoV-2 variants that have been identified, more specifically the UK variant. These are the common post-vaccine symptoms, non-specific symptoms that our people have explained or expressed. The mild fever and the aches and pains are relieved by acetaminophen or paracetamol. Coincidentally, this week we are celebrating Vaccination Week in the Americas, and so the Ministry of Health, Government of St. Kitts and Nevis, in collaboration with our CARICOM member states, Pan American Health Organization, World Health Organization, we are celebrating Vaccination Week in the Americas. It's a week when we focus on vaccines in general, vaccines on a whole. And the whole aim of this week of activities is to put a spotlight on vaccines, the value and importance of vaccines in terms of preventing infectious diseases, keeping them at bay, maintaining health, and bringing families closer. And so it's no surprise that this year's theme is, and I quote, "Vaccines bring us closer, #GetVax," end of quote. And so again, as I said, the spotlight this year is on the newest vaccines on the market, the COVID-19 vaccines. These vaccines are our best hope in ending this pandemic and rebuilding our local and regional economy. And it's interesting to note, just for information, that there is yet another vaccine on the market, and it's against a long-term infectious disease, malaria. And so we got news, I think last weekend, that this vaccine has come to the fore with a 70-something% efficacy. And so that's the latest kid on the block in terms of vaccines, a vaccine against malaria. Now, what are the benefits and value of the AstraZeneca Oxford vaccine? So many persons who have not yet consented to receiving this vaccine, they ask this question: tell me why I should take this vaccine. What are the benefits? And so one, it's approved by the World Health Organization, and so that's good. Two, it's effective. And so this vaccine is effective in reducing your risk at contracting SARS-CoV-2 or COVID-19. It reduces your risk by as much as 83% once you receive 2 doses, 8 to 12 weeks apart. It's effective in preventing severe COVID. It's effective in preventing death. Thirdly, This vaccine works well in older adults. The results from recent studies confirm a vaccine efficacy of as high as 85% in persons who are over 65. Again, given once they would have received 2 doses 4, 8 to 12 weeks apart. So it's approved by the WHO, it's effective, it works well in older adults. This vaccine also provides protection against the emerging SARS-CoV-2 variants, particularly the UK variant. So the studies or the latest scientific data tell us that there is high efficacy against the UK variant, and it also provides some protection against the variant identified in South Africa and Brazil. As a matter of fact, the scientific literature suggests that most of the COVID-19 vaccine candidates provide some protection against most of the variants that are emerging and of public health concern. Number 5, the latest scientific information suggests that the AstraZeneca-Oxford vaccine reduces the transmission of SARS-CoV-2 virus. However, more data is required to determine the true extent of this reduction. So in other words, if you are fully vaccinated, let me just pause. Somebody is deemed to be fully vaccinated if you would have received the 2 doses of the AstraZeneca vaccine and 2 weeks would have elapsed. And if you are in the US and you receive the 1 dose of the Johnson & Johnson vaccine and 2 weeks would have elapsed, then you would be deemed fully vaccinated. So if you are fully vaccinated from the AstraZeneca-Oxford vaccine, the vaccine provides you a reduced risk, or there's a reduction in the risk of your picking up the virus, and if perchance you do, there is a reduction in the risk of your being able to transmit the virus to another individual. And so that's important, and that's the bit of information we were awaiting for months. And so we are happy to learn this, and more scientific work is being done in this area in order to inform us as to the true extent of this reduction. Please note that this vaccine has a wide global reach, and just recently, through the COVAX facility, some 142 countries have received and continue to receive millions of doses of this AstraZeneca-Oxford vaccine. So ladies and gentlemen, there are innumerable benefits from taking or coming on board in terms of accepting this vaccine. And so last evening, we, on Leadership Matters, the Honorable Prime Minister, Dr. Timothy Harris, would have announced some policy changes. And so this afternoon, I'm going to try and summarize these policy changes, or changes to our existing health and travel protocols that have been governing the Federation, or the operations in the Federation, over the past 5 to 6 months. 1, he announced a reduction in the quarantine time for inbound air travelers who are fully vaccinated with the following COVID-19 vaccines. 1, Pfizer-BioNTech vaccine, Moderna, AstraZeneca Oxford, and Johnson & Johnson. So if we have an inbound air traveler fully vaccinated with either of these, so in other words, 2 doses of the Pfizer-BioNTech, 2 doses of Moderna, 2 doses of the AstraZeneca Oxford, or 1 dose of the Johnson & Johnson, and 2 weeks would have elapsed before your travel date, then the individual would be deemed fully vaccinated. And so if you find yourself in this category, there will be a reduction in your quarantine period upon arrival into the Federation of St. Kitts and Nevis. There are some other requirements for such individuals. So fully vaccinated individuals would still have to provide us a negative pre-arrival RT-PCR test done within 3 days of travel to the Federation. Fully vaccinated inbound passenger may be tested on arrival at RLB or at the Vance Emery Airport if the pre-arrival test is outdated or if it is not acceptable. You will still be asked to complete the entry form on knatravelform.kn, and then you will be transferred from the airport to your quarantine or vacation and the individual can be officially released from quarantine if a negative RT-PCR test is returned on day number 9 of quarantine. So your sample will be taken on day 9 and your results would be returned thereafter. So upon receipt of a negative RT-PCR test, you will be officially released from quarantine. A pre-departure test is not required by the Federation at this time. However, please note that our requirements in this regard may change if we identify any cluster of COVID-19 cases or community transmission. However, please note that a pre-departure test may still be required if the country of destination requires it. So, if you are fully vaccinated and you are leaving the Federation, going back to the US or the UK, Canada, or further afield, if the country of destination requires a pre-arrival test, you will have to do a pre-departure test for that purpose. Number 2, the Prime Minister would have announced that fully vaccinated spectators would be able to access venues of amateur and recreational sporting events effective May 20, 2021. However, the following requirements must be adhered to. Spectators must maintain hand hygiene. Spectators, meaning the fully vaccinated spectators, must wear a face mask, and you must adhere to the requirement of 50% spectator capacity, and the organizers should maintain or must maintain a registry of names and contact information of all the fully vaccinated spectators who are admitted to the venues, along with temperature checks. Please note that the fully vaccinated amateur and recreational sporting event organizers must first seek approval from Ministry of Sports and the Commissioner of Police. The Prime Minister also announced that favorable consideration would be granted to fully vaccinated cultural and entertainment events whereby only fully vaccinated patrons are allowed entrance. The recommended start date is July 19th, 2021. However, again, the following requirements must be adhered to. Fully vaccinated patrons must maintain hand hygiene. There would be temperature checks at the entrance of the event. The patrons would be required to wear face masks, and the organizers would be required to maintain a registry of names and contact information of patrons, and there should be adherence to the 50% patron capacity. Now, all event operators, event staff, and entertainers must be fully vaccinated. Please note that the organizers of these fully vaccinated events must first seek approval from Commissioner of Police. Please note that there would be mixed cultural events still taking place in the Federation. When I say mixed, I'm referring to an event that will be catering to vaccinated and non-vaccinated patrons. These events must adhere to existing protocols. Weddings, funerals, and church services are considered mixed events whereby there would be vaccinated and non-vaccinated persons in attendance. Again, these events would be in adherence to the existing protocols. Please note that these recommended policy changes can be amended immediately if our local COVID-19 status changes. Ladies and gentlemen, it's still the goal of the Federation to attain the 70% herd immunity threshold, whereby 70% of our population should be vaccinated. And we are hoping to achieve this by September of this year. This is just a reminder of the essential public health actions that we have to continue and maintain in order to keep safe. We need to learn the lessons from our sister island, Anguilla. Protect yourself. I am protecting myself against COVID-19 through vaccination. Hashtag vaccines work. Hashtag do not wait, vaccinate. I thank you.